Does Accutane cause depression and psychiatric disorders? More recently, like November of 2023, a study came out of Harvard. It was a meta-analysis with like 1.6 million people who have taken Accutane, looking at the history of all these people, how many of them ended up with psychiatric disorders, and found that not only did it have no risk for increasing any psychiatric disorder, but it actually found that there was a statistically significantly reduced risk of suicide and suicidal ideation for people who had taken Accutane compared with people who had taken any other form of treatment or no treatment at all, which is super fascinating and just kind of makes sense because your skin is clear. You can leave your house and feel confident in the skin that you're walking in.
For something like that, having a good support system is extremely important. So a lot of teenagers experience depression, experience suicidal ideation, and if they're isolating themselves because they think that they're too ugly, which is not the case. If you have acne, no need to isolate. No one really cares as much as you do about your acne, but it doesn't stop you from feeling that way, right? And so having a very effective treatment for acne, something that really works, is going to help you come out of your shell and experience life to the fullest in some people. And so that makes sense from that perspective, the result of that meta-analysis.
We literally even see that on photos in Honeydew, serious and frowning in their initial photos, and then by the end of their course of treatment with us, they're happy, bright, smiling in the photos that they're submitting of their skin. It could just be monitored really effectively, and it's not something that you have to fear with taking the medication. What we do on Honeydew, for example, for everybody who's on Accutane, regardless of whether you have a pre-existing mental health condition or not, we do what's called the PHQ-2 screening, which is just this peer-reviewed screening of how somebody's mental health is doing, and we do that every single month when we check in with the patient. And then if they score a certain amount, we'll escalate it to a larger questionnaire. And for anybody who has a pre-existing mental health condition coming into Honeydew when they're starting on Accutane, we actually work collaboratively with their mental health provider. We get in touch with them, make sure that they're aware that they're starting Accutane so that they can monitor, and stay on top of the mental health symptoms if there are any, while we manage the skincare portion of it.